our goal is to help every child grow up to live their best life, now, and to also grow up to live their very best life in the future. And in order to do that for cerebral palsy, you really have to pay attention to more than just the motor disorder. We address the motor disorder and help children move, but we also address all of the other associated impairments that can happen in children with cerebral palsy and their health, to give them the best quality of life. You know, a lot of parents go and see many different doctors, go to different appointments with different physical therapists. They have so many different people telling them what to do that it's really hard to put things together and figure out, okay, I can't possibly get all these things done. I've been given 150 tasks to do by different people, and sometimes nobody's talking to each other. So how do I figure out what is the most important thing to start with and what is going to have to wait till later, and then how do I fit it into my daily life? So it's a collaboration between the family and the doctor based on parents' goals, patients' goals, and what we want to get done. One of the strongest motivators for families is to show them what their child can do, to focus on their strengths, and to give them hope. And so once you help them achieve a goal or a stepping stone to a goal, then the world opens up for them, and then patients are much more motivated. One way that we get patients motivated for doing exercises and getting stronger is to use sports programs and get them involved in sports. And I just moved here from St. Louis, but in St. Louis we started this big comprehensive sports program. We started with martial arts, and then we added swimming, and then we added basketball, and then a couple, Carol and Paul Hatfield, endowed an entire sports program, and now we have in St. Louis Camp Independence, which is 6 or 7 hours a day, Monday through Friday, total immersion in sports. But that all started with one sport at a time. But sports is a very vital way to get children, and especially adolescents, motivated and involved. And also, it's therapy. It's therapy without doing therapy. It's fun, and it gets them involved in real life. And that's something else that we are going to bring here as well.